Hi everyone. Today I am discussing about the topic thyroiditis. Thyroiditis means inflammation of the thyroid gland. The word itis means inflammation. So thyroiditis means inflammation of the thyroid gland. And what are the contents covered in this topic? The introduction and what are the phases involved in the thyroiditis? What is the classification and what are the causes and symptoms? How it is diagnosed, how it is treated. Let's start. And coming to the introduction, what is thyroiditis? Thyroiditis means inflammation of the thyroid gland. And what is thyroid gland? Thyroid gland is very small and butterfly shaped, which is located at the front of your neck and under the skin. Okay, it is a part of your endocrine system which controls the body metabolism, body temperature, and also controls the producing and releasing the certain types of hormones like TSH, T3, and T4 and calcitonin also. And this thyroiditis can lead to overproduction or underproduction of the thyroid hormones that leads to hyperthyroidism or hypothyroidism. Then next one, what are the phases which are involved in the thyroiditis? In most cases of thyroiditis, there are three phases including. They are thyrotoxic phase, hypothyroid phase, and euthyroid phase. Coming to the first one, thyrotoxic phase. During this phase, the thyroid is inflamed, so it leads to release of excess hormones that results in temporary thyrotoxicosis. Next one is hypothyroid phase. After releasing of the excess releasing of the thyroid hormones for a few weeks or months, the thyroid won't have enough hormones to release. So this leads to lack of thyroid hormones, which results in hypothyroidism. For example, in case of Hashimoto's thyroiditis and radiation-induced thyroiditis, they are permanently stay in the hypothyroid phase. That means they are lacking of thyroid hormones. And next one is euthyroid phase. In this phase, the thyroid hormones levels are normal. This phase may come temporarily after the thyrotoxic phase. That means after releasing of excess hormones or before going to the hypothyroid phase. That means before they lack the thyroid hormones, or it may come at the end of your thyroid gland has recovered from the inflammation and can maintain a normal hormone level. Okay, these are the three phases which are involved in the thyroiditis. And coming to the classification of thyroiditis and what are the causes and symptoms of the thyroiditis. Firstly, we talk about the classification. Okay, the classification is mainly depends upon they are mainly due to the thyroiditis mainly occurred due to either autoimmune disease, either due to infections, either due to fibrosis, either due to drugs. Okay, they are divided into two types. They are painful and painless. Painless thyroiditis is usually seen in infectious. Okay, and subacute thyroiditis and traumatic and radiation induced thyroiditis, these all are painful thyroiditis. Painless thyroiditis is autoimmune and postpartum and drug induced thyroiditis, and it can be classified into either acute, subacute, and chronic also. Acute thyroiditis is mainly caused by the bacterial infections of the gland, and subacute is mainly due to viral infections, and chronic is mainly due to autoimmune diseases and like Hashimoto's thyroiditis and postpartum thyroiditis and other painless thyroiditis, which includes iatrogenic and drug induced thyroiditis. Okay, clear? And coming to the next slide, who does thyroiditis affect? Mostly the thyroiditis affects the people assigned female at birth. At birth, who are assigned with females, they are usually affected with the thyroiditis. In case of Hashimoto's thyroiditis, which is more commonly seen in 10 times more commonly seen in AFAB than assigned male at birth adults. In case of 30 to 50 years age people are mostly affected, and silent or painless thyroiditis is also common in AFAB. That means assigned female at birth. How common is thyroiditis? Mostly 1 to 2% of people affected in USA, that is Hashimoto's thyroiditis. And what are the causes of thyroiditis? What are the causes of thyroiditis? The thyroiditis can occur due to either autoimmune disease or either due to infections, either due to drugs, and also due to fibrosis. Okay, we clearly talk about each of these diseases. See, this chart lists out the causes for each type of thyroiditis. I will explain each and every one of the thyroiditis. Firstly, we talk about acute and subacute and chronic thyroiditis. In case of acute thyroiditis, which is mainly caused by the bacteria, they are gram-positive bacteria. They are Staphylococcus and Streptococcus fungi and mycoparasitic infections. And in this case, there is a destruction of thyroid parenchyma takes place, which causes radiation-induced thyroiditis. After exposure to the radioactive iodine for treatment for the Graves' disease or thyroid cancer, and higher dose of radiation to the neck for the lymphoma and other head and neck cancers. So in these cases, there is a treatment takes place. So the thyroid parenchyma is destructed. So it leads to bacterial infection. Okay, this is one of the cause for the acute thyroiditis. And coming to the next one, subacute thyroiditis. There is dequervine thyroiditis, which is mainly caused by the viruses like Coxsackie, A, B, and ecoviruses. Okay, these are mostly the granulomas are formed in the thyroid gland, which become fibrotic but can return to normal after the treatment only. Okay, then coming to the next one, chronic thyroiditis, which includes autoimmune diseases. They are Hashimoto's thyroiditis, postpartum, and drug induced. Okay, these all three are covered. Firstly, autoimmune disease, that is Hashimoto's thyroiditis, mm, which is usually characterized by the lymphatic infiltration of the gland, which presumed to be due to similarities between the thyroid protein and the viral structure, resulting in cross-reacting antibodies. You can understood, there is a lymphatic infiltration of the gland, that leads because there is a similarity between the thyroid protein and the viral structure, which resulting in cross-reacting. So the anti-TPO antibodies that are present in 90% of the patients with Hashimoto's thyroiditis, which fixes the complement and or hence capable of inducing the antibody dependent cell mediated cytotoxicity, which causing the death of thryocytes. Okay, this leads to the autoimmune disease, that is the Hashimoto's thyroiditis. Other one, we are talking about postpartum thyroiditis. That means there is a destructive thyroiditis, which is mainly due to lymphocytic infiltration of the thyroid gland. Okay, the fetal cells that migrate to the maternal thyroid gland, which tend to survive the immunocompromised pregnancy state, and when the maternal immune system rebounds postpartum, so which activates the autoimmune phenomena, which causes the postpartum thyroiditis. Okay, then next one is drug induced thyroiditis, which is mainly due to, which causes the hyperthyroidism, mainly due to increase in the release and synthesis of the thyroid hormones, or by the destructive thyroiditis caused by the release of preformed hormones. And so hyperthyroidism is mainly due to excessive release of hormones or due to destructive thyroid caused by the release of preformed hormones. Hypothyroidism is mainly due to decrease in the synthesis of the hormones. Okay, then coming to the drugs, what are the drugs involved in the drug induced thyroiditis? They are amiodarone and lithium and tyrosine kinase inhibitors and checkpoint inhibitors. Okay, firstly amiodarone, which causes both hypo and hyperthyroidism. In case of euthyroid patients, there is a transient changes in TFT, that means thyroid function test, following by normalization. In patients having underlying Hashimoto's there is a risk of hypothyroidism. But in case of hyperthyroidism, there are two ways. There are type 1 and type 2. In type 1 is there is increased synthesis of release of thyroid hormone, but in case of type 2 there is a destructive thyroiditis leading to the release of preformed hormones, that is T3 and T4. Okay, and next drug is lithium. Lithium is also decreasing the secretion of thyroid hormones, that leads to hypothyroidism. So there is a rise in the TSH. It leads to the enlargement of the thyroid gland. Okay, then coming to the tyrosine kinase inhibitors, which is also leads to both hypo and hyperthyroidism. Okay, so these are the causes for the each type of thyroiditis. And sorry, I'm talking about radial thyroiditis, which is known, in which there is an unknown pathophysiology. There is a chronic inflammation by the mononuclear cells, which leads to the fibrosis. Okay, and it is also leads to autoimmune pancreatitis, interstitial pneumonia, orbital pseudotumors. Okay, so coming to the next one, what are the symptoms of thyroiditis? The symptoms of thyroiditis mainly depend upon the thyroiditis and also its phase also. And most type of thyroiditis causes thyrotoxicosis symptoms, which followed by the hypothyroid symptoms. Subacute thyroiditis and acute infectious thyroiditis usually causes pain in your thyroid area, and some people with thyroiditis which leads to enlargement of the gland. And coming to the symptoms of thyrotoxicosis. Usually, the thyrotoxic phase of thyroiditis is usually short, lasting 1 to 3 months. That means if your thyroid cells are quickly damaged, there is a leak of excess hormones which leads to hyperthyroidism. There are certain symptoms which involved in hyperthyroidism. There is a fast heart rate, that is tachycardia, and increased appetite, and but unexplained weight loss, and anxiety, nervousness, and irritability, and insomnia, trouble sleeping, and increased sweating and sensitivity to heat, and tremors also. Okay, then what are the symptoms of hypothyroidism? This hypothyroid phase of thyroiditis can be long lasting and may become permanent. If your thyroid cells are damaged and thyroid hormone levels are fall, you might experience the symptoms of thyroiditis, hyperthyroidism, which includes fatigue, unexplained weight loss, weight gain, and constipation. There is a depression, dry skin, increased sensitivity to cold, muscle weakness, and decreased ability to concentrate and focus also. Okay, and coming to the next one, how it is diagnosed and how it is treated. Firstly, the diagnosis of thyroiditis includes clinical examination, blood test, and various imaging tests. While clinical examination, you will take past medical history like prior pregnancy, there is any viral infection or any history of autoimmune diseases, and review of your medications and what are the medications used by the patient, and family history of thyroid disease, as well as focused on the palpation of the thyroid gland. Okay, and next one is blood test. In case of blood test, there is thyroid function test to measure the thyroid stimulating hormone T3 triiodothyronine and T4 thyroxine levels also measured. And in case of thyroid antibody test, you can measure the thyroid antibodies, that is TPO, and thyroid receptor stimulating antibodies TRAB. These antibodies could signal that you have a symptoms of thyroiditis, which mainly caused by the autoimmune disease. They are either Hashimoto's or any autoimmune disease. And another blood test is erythrocyte sedimentation rate, that is ESR. ESR is increased when inflammation in the body. ESR is high in subacute thyroiditis, and CRP is also high in inflammation in your body, and it is usually significantly elevated in acute infectious thyroiditis. And imaging test also, we can involve radioactive iodine uptake, test and also thyroid ultrasound test. In case of thyroid ultrasound test, we can evaluate the anatomy of your thyroid gland. That means if you have any growth or any nodule in the thyroid gland, the blood supply is changed, the blood flow is changed to your thyroid gland, and the density of the gland is also changed. And in case of radioactive iodine uptake test, this test measures the amount of radioactive iodine taken by the mouth and that is absorbed by the thyroid gland. The amount is always low in the thyrotoxic phase of the thyroiditis. Okay. Then coming to the treatment. Treatment is also mainly depends upon the type of thyroiditis and what are the symptoms present. And coming to, they are also divided by acute, subacute, and chronic. In case of acute thyroiditis, if patient with infectious thyroiditis, we are given non-surgical management like antibiotics and NSAIDs are given for the neck pain and inflammation. There is also surgical intervention also takes place when it is for abscess drainage. In case of radiation-induced thyroiditis, the treatment is symptomatic with NSAIDs, and prednisolone is also used in severe cases. Okay. Then in case of subacute thyroiditis, usually which is self-limiting, there is a symptomatic management is needed, that is NSAIDs for the pain control and beta blockers for the tachycardia and corticosteroids for the reducing the inflammation. If there is a severe pain and severe symptoms of thyrotoxicosis, these are prescribed. But in case of chronic thyroiditis, that is autoimmune diseases, Hashimoto's thyroiditis, they are, in case of hyperthyroidism, we are given propylthiouracil and methimazole. And but in case of postpartum thyroiditis, usually which is very transient, 80% of patients become euthyroid. Okay. So in case of hypothyroidism patients, levothyroxine is given, and amiodarone induced thyroiditis, both hyper and hypothyroidism. In case of hypo, we can give an amiodarone and levothyroxine, and in case of hyper, there are also two stages now, type 1 and type 2. For type 1, we are given beta blockers and methimazole. For type 2, glucocorticoids are given. In case of drug-induced lithium, lithium plus levothyroxine is given for the management, and reduced thyroiditis is surgical intervention is mainly prescribed. And there is a differential diagnosis also: thyroid cyst, thyroid cancers, thyroid nodule, and tonsillitis, and acute pharyngitis. These are similar in this type of diseases. And coming to the prognosis, the prognosis of thyroiditis is good, but in case of Hashimoto's thyroiditis, lifelong thyroid hormone replacement therapy takes place. But in case of subacute thyroiditis, the symptoms is usually lost for 1 to 3 months, but complete recovery of thyroid function can up to take 12 to 18 months. And we also discuss about the complications of thyroiditis. They are hypothyroidism, that is myxedema coma. In this case, hypothyroidism that leads to hypothermia, hyponatremia, and bradycardia, which is usually affected in older patients. So the treatment is steroids are given. And also another complication is thyroid storm. In this case, hyperthyroidism, hyperpyrexia, fever, tachycardia, agitation, and psychosis takes place. And another complication is thyroid lymphoma and carcinoma. So this is all about thyroiditis. We discuss each and one of the diseases. So I hope you all understood. Thank you.